Good afternoon, everyone, and welcome to today's COVID-19 update. Today we have Dr. Dina Hinshaw, Chief Medical Officer of Health for Alberta, and Dr. Verna Yiu, President and CEO of Alberta Health Services. Dr. Hinshaw.
Thank you, Chris, and good afternoon, everyone. Before I begin, I want to note that I will once again be providing regular COVID-19 updates twice a week. Given the crisis that our province is facing and the state of public health emergency that was issued yesterday, I will keep Albertans informed and will be here regularly to answer questions to the best of my ability. I also want to pause here to stress one point from yesterday's announcement regarding the restriction exemption program. If you were seeking a negative COVID test result to access a business or service, you must get this test privately. Alberta Health Services testing is for those with symptoms, those in outbreaks, and those who need it the most. These tests will not be applicable to the exemption program. Of course, instead of paying to get a negative COVID test done privately, you can get vaccinated for free. This will provide real protection, help beat down the wave, and save you the money spent on testing. Turning to today's update. Over the last 24 hours, we have identified 1,718 new cases of COVID-19 and completed about 16,300 tests. Our positivity rate was about 10.6%. Our hospitalizations continue to rise, and there are 896 people being treated for COVID-19 in hospital, including 222 in the ICU. There are now 18,706 active cases in the province. Sadly, I must announce that 10 new deaths were reported to Alberta Health in the last 24 hours. Every life lost leaves behind grieving family and friends, and I offer my sympathies to those who are mourning these losses and losses from any other cause. These deaths and all that have preceded them are further reminders that there are many vulnerable people in our province. As I said yesterday, our actions have never mattered more. We have a collective shared responsibility to keep everyone safe. This is the glue that holds our society together. Today, I want to help clarify some questions that we've heard about the restrictions announced yesterday. I know it was a lot of information at once, and I want everyone to fully understand the rules going forward. Many Albertans are asking why social gatherings need to be limited if everyone attending has been vaccinated. It's a fair question, especially when immunized Albertans have done the right thing and have gotten protected to try to keep others safe as well. The answer is that our healthcare system is straining to treat the number of COVID-19 cases we currently have in Alberta. While close to 78% of the cases currently in hospital, including ICUs, are unvaccinated or only partially vaccinated, that still leaves 22% of those in hospital who are fully vaccinated. Many of these individuals have underlying health conditions that have affected their immune systems and their ability to fight off infections. In addition, while 2 doses of vaccine are generally about 85% effective at protecting against the Delta variant, that still leaves a 15% window for infection. And since the presence of COVID-19 is so high in our province right now, we need to do all we can to safeguard ourselves and our healthcare system and to stop providing all those opportunities for COVID-19 to slip in and spread. We've also heard questions about whether weddings have to follow the 50-person limit if they implement mandatory vaccination. The answer is first that this restriction comes into force on Monday, so events this weekend can continue, although I urge everyone to take every possible precaution in all events. Secondly, venues that host these types of events are able to choose to implement a restriction exemption program with proof of immunization or a recent negative, privately paid COVID-19 test. If a hosting venue has implemented this program, then the wedding or funeral taking place in that location is able to proceed without the cap on numbers, as long as all attendees over the age of 12 have valid proof of immunization or a recent negative privately paid COVID test. Again, a reminder that AHS COVID tests cannot be used for this purpose. Only privately paid COVID tests are an option for admission purposes under the exemption program. Related to that, I have heard some confusion about which businesses count as essential for daily living and so are not able to put in place an exemption program. We're working to put together a list of sectors on the website, but this would include examples such as grocery stores, gas stations, and retail such as hardware stores. Other questions we've heard have been around personal services such as hair salons. These are subject to the mandatory masking rule and a requirement that physical distancing be maintained at all times except for while the service is being provided. Finally, we have also heard questions about whether businesses need to apply for the restriction exemption program to be eligible. The answer is no. Businesses simply need to consult the material we will be posting tomorrow on our website and implement the process described there in order to qualify. However, audits and enforcement will occur to make sure the rules are being followed. Starting Monday, any location that is not following the restrictions but has not properly implemented a vaccine verification system would be violating the public health orders in place. All of the public health orders are mandatory and legally enforceable. Any police agency or public health inspector is empowered to take enforcement action as they see fit. However, enforcement is always a last resort. As I said yesterday, hard as it may seem, we need to work together to beat back this current wave. I know the new measures come as a disappointment to many who have worked diligently to keep our province safe. I know that many are frustrated and tired, and both of these are understandable. However, despite this tiredness and frustration, the virus is not going to stop without us. We are all currently playing a role in preventing the spread of the virus, protecting ourselves and protecting our community. By following these rules in not just the letter, but the spirit of them, and avoiding contact as much as possible with those outside our household, we can get back on track and bring our cases and, most importantly, our severe outcomes down. This is the key to reducing pressure on the healthcare system and saving lives. Thank you, and I'll turn the podium over to Dr. Yiu to provide an update on the healthcare system.
Good afternoon. This afternoon, I want to provide some further updates in terms of the pressures on our healthcare system and what we are doing to increase capacity. Pressure on our healthcare system continues to be severe. We continue to add capacity wherever and whenever we can, and we can also see more and more patients are actually being admitted to the critical care units. We currently have 310 beds open in Alberta, including 137 additional what we call surge spaces. AHS has opened 43 additional ICU surge spaces in the past 7 days. There are currently 268 patients in the ICU, 75% who are afflicted with the COVID virus disease. Provincially, ICU capacity, including additional surge beds, is at 86%. But remember, without these additional surge beds, provincial ICU capacity would be in excess of 155%. The number of patients in ICUs increased by 16% in the past week. This fourth wave has resulted in the sharpest increase in ICU patients that we have seen throughout the pandemic. And I continue to be amazed by our incredible physicians and staff who work tirelessly in providing care and creating capacity. Because of your dedication and efforts, Albertans are able to get the care that they need. I've said before that healthcare is a finite resource. We do not have the ability to simply open more and more ICU spaces and hospital beds, and we do not have an endless number of staff who can provide critical care. I'm aware that one of our internal planning documents was shared publicly this afternoon, which suggests that we are days away from having our ICUs overwhelmed. There is no question that our ICUs are under extreme pressure. We continually are finding ways to increase our capacity, and our numbers change daily, if not hourly, and the teams are working 24/7 to ensure that we don't reach that point. Our goal right now is to open as many critical care spaces as we can, safely staffed, and create as much space that we need, anticipating the numbers that are coming ahead. But let me be clear though, these are not standard ICU beds. Care will be and always, and is already different as we move to different staffing models and different spaces. This is extremely challenging. We continually do all that we can in the face of this ever-changing pandemic. AHS has moved to its highest level in terms of its surge response. This step is designed to add additional capacity using a number of different tools, and I'd like to briefly talk about those now. We have asked our teams to identify and open any spaces that can be used as an ICU bed. This includes spaces such as operating rooms, post-anesthesia care units, observation spaces, and recovery wards. This means that patients needing critical care may receive it in a space that is not usually used for ICU. We are taking measures to ensure this is safe, given the extraordinary circumstances. Our pandemic response units in Calgary and Edmonton remain in a state of readiness, and we will open them if the situation requires that level of care. We continue to discharge patients home or to a continuing care setting as soon as they are ready to be moved. This may mean that patients are transferred to a facility that is outside their home community or their zone. And we're having to postpone further surgeries. This is a tremendously difficult decision, and again, I'm deeply sorry to all those who are affected. Any surgery that must be completed within a 3-day window will continue, and all non-urgent scheduled surgeries will be postponed. As I mentioned yesterday, we have reached out to other provinces to see if they have any available space where Albertans could get the care that they need. And we are asking them if they have skilled frontline staff who may be willing to come to Alberta to assist us. Ontario has graciously offered their help, and we are in discussions with them regarding potential transfer of patients if needed. We remain hopeful that it will not come to those terms as our teams continue to add critical care capacity in Alberta. I cannot stress enough how serious the situation is in our hospitals. I promise you that we will continue to do all that we can to provide the care to Albertans. I also cannot stress enough that we need your help. Please get immunized. If you have any fears, concerns, or hesitations, please reach out to a healthcare professional, call 811, or visit the AHS website. The vaccine is safe and effective. We know that people have different reasons for not being immunized. If transportation is an issue, or if there are other barriers, please call 811 and we will help you. We are seeing an increase in people booking appointments to be immunized in the past several days. This is very positive, and I thank you. And I thank everyone who is immunized. I also want to recognize that people are stressed and there are more rough days ahead. So thank you for being kind to those around you, to those who work in our hospitals and our immunization sites. And please follow all public health restrictions. By doing this, you are helping us to help all Albertans. And finally, today, I want to take an opportunity to thank all of our healthcare workers. Many of you have agreed to work extra shifts, to start work earlier or stay later, working weekends, holidays, canceling your plans at the last minute, and giving your absolute all, day in and day out. This has come at a great cost. I understand and acknowledge the stress and the strain. It is not sustainable, and yet we continue to ask you for more. There are no easy solutions to this fourth wave. We want you to know that we're taking all steps to ensure we can continue to support you in providing care to those who need it. We will continue to be here for all of you and for Albertans. At the end of the day, none of this is possible without you. So thank you for your attention. That's the end of my comments.
Thank you, Dr. Yiu. So we'll begin the Q&A portion of today's news conference. We have media here in the room and on the phones. For media in the room, if you could state your name and outlet at first, that would be great. And we will start in the room here in Edmonton today.
Cool. Hello, Lauren Boothby with the Edmonton Journal, Edmonton Sun. A question for Dr. Hinshaw first. Dr. Hinshaw, we heard you announce, you and the Premier and Health Minister announced a whole bunch of restrictions yesterday. Do you think it's going to be enough to be able to stop our hospitals from being overwhelmed? Did we move fast enough in order to prevent that? And how long do you think it'll be until we see the effects of these new rules?
Thank you for the question. The measures that came into place yesterday are wide-ranging in terms of the number of sectors impacted. There still are provisions to allow for activities to take place, and the ability for these restrictions to be effective in protecting our healthcare system is up to all of us. It is up to all of us to look at the restrictions, to follow them, not just the letter of them, but wherever you're in doubt, whenever any of us are in doubt about whether something is permitted or not, we need to err on the side of caution right now. We need to minimize the number of people we're in close contact with outside our household. We need to minimize the number of activities we're participating in. And by doing that together, then we can ensure that the restrictions that came in place yesterday, the ones that come into place on Monday, have the maximum possible impact. The question about timing, of course, we know that when restrictions are implemented, it typically takes 1 to 2 weeks before we see the impact of those on cases, and then it can take longer before the impact of that is seen on our hospital system. So as Dr. Yiu said, there are tough days ahead, and we all need to do everything we can to bring our numbers down, to make sure that we are supporting those around us to understand the most reliable information when it comes to vaccines, and for those who choose not to be immunized, to stay at home as much as possible and prevent spreading disease to others or becoming infected yourself.
Lauren, do you have a follow-up?
Yes, I do. I wanted to ask another one of Dr. Hinshaw, actually, or maybe Verna Yiu. I'm not sure which one of you will answer. But a few times yesterday, I think Dr. Hinshaw and I know the Premier mentioned how difficult it is to make restrictions when there's a population who's not willing to accept them, and that it's been difficult to enforce things like mandatory isolation for people who don't believe in COVID. So adding a whole bunch of restrictions yesterday and having that the vaccine passport is opt-in and you're not going to have to register to be part of it, and you'll only be detecting these with audits. Do you anticipate there being a challenge in enforcing these things? And given the experience over the last after the last year, and does AHS have enough people to be able to do that enforcement work to track the compliance?
I'll maybe speak to the initial parts of the question and then the specific enforcement piece perhaps pass to Dr. Yiu. We know that in Alberta, as in other parts of the country and quite frankly around the world, there are some who have chosen to believe misinformation about the virus. We know that some of those individuals are choosing to not follow restrictions. However, that is not the majority of Albertans. And I believe that the majority of Albertans want to do the right thing. They care about their neighbors, they care about the healthcare system, and that when we provide the specific information that must be followed for a business to be able to be exempted from the current requirements or the current restrictions, that from what we've heard from business operators, from different sectors, that people are very keen to understand the rules because they want to follow them. They want to do the right thing. So when it comes to challenges, of course, there are some, but I want to emphasize that those individuals who are deliberately choosing to put others at risk are not the majority, and that even someone who may choose to not be immunized, that most of those individuals are also not wanting to willingly put others at risk. And again, I ask that all those who've chosen to not be immunized be sure that you are doing everything you can to minimize close contacts, pay close attention to any symptoms, and stay away from others if you have even a slight symptom. So with respect to the exemption program, again, when the majority of Albertans pitch together and make sure that we're doing everything we can, then we will be successful. And I'll turn it over to Dr. Yiu with respect to the enforcement piece.
It's been a long 19 months, and we've done a lot of work with supporting our public health inspectors to work with the communities and local businesses. And I just can't emphasize enough that the majority of groups that we work with want to comply. It's about education, it's about helping provide them with the supports in terms of the processes that they have to bring on. And so we're confident that we are going to be able to continue to work with the majority of communities and businesses, and that they will choose to do the right thing, which is to follow the public health guidelines.
Sorry, you didn't answer the part about if you have enough staff to do all of that.
Yeah. So we do have a fixed number of public health inspectors, and there have been previous public health restrictions. And so we do know that the volume of the complaints and the different businesses that we had to review actually increased quite a bit during COVID. And they did manage to work with the different groups in the different communities, and I'm pretty confident that we have enough public health inspectors. And as I said, it has been a tiring 19 months, and so it's not going to be easy as they go out to continue to do this work, but I do feel that there is enough right now.
We'll go to the phones next. Operator, can you put through the first caller?
Carlisle Pizzette, CTV.
Hi there. My first question is for Dr. Hinshaw. When it comes to people who now say are going to a restaurant that is implementing this exemption restriction system, a customer has no idea whether or not their server may be vaccinated or not, or if they have provided a negative test. So for them, what's the point of forcing customers to go through this process when employers are under no obligation to make sure their workplace has been vaccinated or provides negative tests?
When we looked at other provinces that have implemented vaccine requirement mandates, we noted that there's no other province that has extended those mandates to employees of affected businesses. So the program in Alberta is consistent with other provincial mandates, which separates out employee requirements that an employer can choose to put in place, and the requirement for patrons to have proof of vaccination, or in this case, proof of a recent negative test to access that. Employers may choose to require employees to be immunized. That certainly is something that is within their rights to do. However, again, in implementing this program, we wanted to be consistent with other provinces and have focused the program again on patrons for that reason.
Carlisle, do you have a follow-up?
Yeah, my follow-up would be for Dr. Yiu. You know, there are concerns from physicians and other healthcare workers that increasingly seem to be more about staffing levels than physical space for patients in the coming days, let alone weeks. I know you've already mentioned about, well, we're doing everything we can to increase our capacity, whatever that may be. But when it comes to patients getting the adequate care that they need, if there literally aren't enough healthcare workers in Alberta to do that in the coming days, what's going to happen?
Yeah, right now we've been doing our we have a bunch of major strategies that involves trying to optimize the number of the workforce, as you've highlighted. It is a workforce capacity issues that we are currently struggling with, especially in the ICU. We're redeploying staff, for example. We're bringing on staff that have had ICU training in the past and bringing them back into the system. We've expedited ICU training so that we can bring sort of regular ward staff to try to get them into the ICU. We're also doing sort of different, what we call alternate staffing models, which is looking at very skilled, experienced ICU staff that can actually help almost supervise, care for perhaps 2 to 3 ICU patients who also have other skilled staff that are looking after them. So we're working our darndest to actually bring capacity into the system, working with regulatory bodies to look at retired staff, bringing that into the system. It's just a numerous list of all the different efforts. But as I said, it is a finite resource. And at some point, you know, we are going to get to the point where we are going to have to consider out-of-province transfers. I do want to share a story. I mean, I get a lot of emails from staff and from physicians and public. And one of the emails that I got was actually from an ICU physician. And this physician said to me, you know, Verna, I'm going to do my darndest to make sure that we don't have to transfer out of province, because at the end of the day, this is a last resort for us. We don't want to get to that point. And as I said before, our staff and physicians continue to amaze me with the type of capacity that we're continuing to increase every single day since the numbers have been escalating.
Operator, can you put through the next caller?
Carrie Tate, Globe and Mail.
Hi, thanks for taking my question. It's for Dr. Yiu. While I understand that capacity is a shifting number, on the current trajectory of cases and given the steps that you've taken, when do you expect that Alberta's ICUs will be at their max?
I wish I could give you that magic date. You know, from our perspective, the numbers are changing daily and almost hourly. And so, you know, things that were projected from last week already don't even are accurate this week. And again, it's related to the fact that we are continuing to find additional capacity. But it comes at a cost, and the cost is that when we start reducing the procedures and postponing procedures, that's how we're finding a lot of the capacity also. So I honestly don't have a magic crystal ball to tell you or give you a date, just to say that every day we're adding more and more capacity. And if we need to, you know, we'll transfer out of province, but we hope we don't get to that point, which is why we really need Albertans to step up and immunize. Because it's not just for yourself, but it's for your neighbors and your loved ones and the province.
Carrie, do you have a follow-up?
Yes, thank you. I guess related to that then, is there a maximum number of beds that you can forecast? And then while I recognize that the triage protocol has not formally kicked in, I'm wondering if you're aware of any incidents where ICU care has been rationed.
Yeah, so we haven't. The critical care triage tool is basically we've started the educational process. So this week was really sharing with our staff about what it is and really setting up the infrastructure in place so that we, if we had to use it, again, this would be an absolute last resort, that the staff are ready and trained and prepared. In terms of sort of the absolute number of beds that we anticipate that we'll have to do out-of-patient or out-of-province transfers, honestly, again, it's the same question as the date. I actually don't have a magic number for you because, as I said, the teams are just pulling out all the stops to increase the capacity every single day. So there is no magic number that I can tell you, but all I can say is that if the numbers keep increasing, right now we're seeing on average about 18 to 20 new COVID ICU admissions every single day throughout the province. And we need to bend that curve. We need to bend that trend. And the best way to do is to vaccinate. So I just can't say enough how important it is for Albertans to go out and get vaccinated.
Operator, please put through the next caller.
Vincent McDermott, Fort McMurray.
Hi, this is for Dr. Hinshaw. Dr. Hinshaw, how successful has the COVID tracing app been through these past waves? I haven't seen an update on those numbers since the start of the year. And with this vaccine passport program, we're once again hoping that using public money on a tech solution is going to help us get out of this mess. I know you don't have the numbers off the top of your head, but right now, what are they like? Because I've been asking this question since July.
As you likely know, in July, we discontinued universal contact tracing and mandatory quarantine for close contacts. I want to be clear that isolation when someone is having symptoms or if they test positive for COVID is mandatory and required. So if someone has a fever or cough, it is legally required that that individual stay home and away from others. We encourage that person to go for testing, and if they do and test positive for COVID, again, they're required to stay home for 10 days. So just to be really clear that that is legally mandated. With respect to close contacts, however, given that in July we were looking at our situation at that point, we have not required individuals who are fully vaccinated to quarantine after an exposure for some time. And so the volume of work required when people were undertaking many different activities to do contact tracing at that point in time when the majority of people were not required to quarantine was not providing significant additional benefit. So we did discontinue that. And as a result, the contact tracing app, which had been used previously and was in use throughout previous waves of the pandemic, would not necessarily be providing any additional benefit at this point with respect to that close contact notification, since we are focusing that only in high-risk settings such as long-term care, acute care, other settings where there's a significant risk of outbreak. With respect to the restriction exemption program, I want to be clear that this is not, there is a technological component to make it easier. However, the technological component is not required. So if someone has proof of vaccination from the location that they received their vaccine, that paper record is sufficient for them to be able to show proof of vaccine, and the technological solutions are simply ways to make it easier for Albertans and businesses to access that information in a way that is seamless. However, the program itself does not rely on that.
Vincent, do you have a follow-up?
Yeah, Dr. Hinshaw, you spent most of this, like, I've been asking this question since July, and now that I finally get somebody on the phone, the question isn't answered, so I'll ask again. Like, what kind of, like, was this app a success? Did it make a serious dent in, like, in stopping any the pain and destruction that we saw from COVID?
I don't have a summary at hand in terms of the number of contacts who were notified through the app. I know that it was enhanced in the spring to be able to contain additional information on restrictions, certainly where there were some restrictions that were geographic in nature. And so the app had multiple uses, not just the contact tracing component. So I think, and I'm sorry if that's something you've asked before and not gotten an answer to, I don't have that answer on hand, but can work with communications to determine what the final tally was for the number of uses that particular app had. Again, as with any program, it's critical that as many people as possible participate. So while that particular app is, again, not a foundational part of our current response because we are not currently conducting universal contact tracing, the other parts of our response depend on all of us stepping up and making sure that we're protecting our neighbors every single day in everything we do.
Operator, please put through the next caller.
Jason Herring, Post Media.
Hello. My first question is for Dr. Verna Yiu. You say that AHS has reached out to other provinces for healthcare resources, but Manitoba's premier did say this morning his province was willing to offer help, but they had not yet heard from Alberta. Quebec's health ministry told us earlier today they had not received any requests either. Wondering which provinces Alberta has reached out to here and why we haven't asked all jurisdictions that might be able to help Alberta during this crisis for their help.
Yeah, it's almost going live as we speak. So Ontario was contacted last night. Manitoba actually has been contacted today. So I actually have, after this press conference, I'm going to be calling Manitoba, but the ministries have been connected. We've actually been in contact with British Columbia. Obviously Saskatchewan is also struggling, so we have not reached out to Saskatchewan. There are some plans also to reach out to Quebec and potentially another province. So we are doing it live as we speak. So it may be a matter of the hours between your connection or asking their question and right now what we've done to date.
Jason, do you have a follow-up?
Yeah, for sure. Thank you for that, Doctor. The second question for Dr. Hinshaw. I wanted to ask about this gathering policy for fully vaccinated Albertans. I know you addressed this up at the top, but I'm still a bit confused about it. As I understand it, it would be against the rules for 15 fully vaccinated Albertans from different households to gather inside someone's home. But those same Albertans could gather in a bar if that bar is participating in this vaccine passport system. Why is there a different set of rules for vaccinated Albertans when it comes to activities at businesses versus at home?
You may recall in previous waves, we had additional restrictions in place in private dwellings over and above the restrictions that were in place in commercial settings. And part of this is due to the fact that in commercial settings, there are audit processes. There are responsible parties who can oversee and be checked if they are incorporating, for example, at this point in time, proof of vaccination checking programs. So again, as you probably recall in previous waves, one of the very last restrictions to be lifted was the requirement to not have indoor social private gatherings in one's home. And again, that's partly because we know that indoor private social gatherings are one of the highest risks of spread, where people are inside socializing in close proximity to one another. And the opportunity to, again, have a responsible party to enforce and mandate those rules is present in a different way in a business or a formal event setting than it is in a private dwelling. And so we are going forward at this point in time with those restrictions again, because remember at this point that our hospitals have never been under greater strain, and we are asking Albertans at this point in time to follow this current restriction, this legally required measure, because we all at this point need to do our part to protect our healthcare system and each other.
We have time for 2 more questions. Operator, can you put through the next caller?
Aaron Collins, CBC.
Hey, thanks for taking my question. I wanted to ask you something about schools. There's a fair number of cases across the province of COVID-19 in schools, and I'm curious if you're considering bringing back the testing, tracing, and isolation requirements for close contacts of outbreaks in schools.
In schools, we are working closely with the Ministry of Education, and at a local level, local public health is working with schools that have identified clusters of cases or groups of students or teachers who've become symptomatic. We know that last year, when we had mandatory contact tracing as well as mandatory quarantine of close contacts, one of the concerns that we saw was that it was very challenging to identify within a classroom which individuals were or were not within close contact with someone who was infectious. And so last year, prior to having any kind of vaccine protection in the population, we had a very universal approach, and so we quarantined entire classrooms, which resulted in some schools having some classes off on 14-day quarantines several times over the period of several months. And that resulted not only in disruption of learning, but also mental health issues for the students involved, and the kinds of repercussions, again, that we're trying to weigh out as we move forward with our COVID response. So at this point in time, our approach to schools is focused on identification where there is a group of students or teachers or staff in a particular school who are falling ill, and then having outbreak measures in place in those schools. As you know, we've also implemented additional measures, including cohorting in elementary schools, universal mandatory masking, to add additional layers of protection in schools. But we know that for schools, the greatest protection we can give them is to bring the case numbers down in the community. And so part of why, again, we're asking all Albertans to work together right now is to protect our kids and protect our schools, because schools have not historically been the place that puts the community at risk, but the community can put our schools at risk. So again, one more reason why we all need to work together right now to make sure we bring our cases and our severe outcomes down.
Aaron, do you have a follow-up?
Yeah, so I guess that's a no for bringing back the tracing and isolation for close contacts. I guess, you mentioned the spread in community being an issue and having to bring that down to protect the students. Obviously, spread is very high in Alberta currently. So I want to ask both Dr. Yiu and Dr. Hinshaw, what would your advice be for parents who receive those letters from the school saying their child is a close contact but have no real recommendations for what they should do? So what should parents do? Should they keep their kids home? Should they send their kids to school? It seems like there's a lot of confusion out there.
That's understandable. Again, we had all gotten used to a particular way of dealing with COVID last year, and schools are just starting back up. So this is a new way of dealing with it. And of course, completely understandable to have those adjustments and learning processes as we go through this. What I would say is if a parent gets a letter that indicates that there has been a case in the school or a case in the class, that they would do the same thing that we would advise all parents to do, which is to watch extremely closely for any symptoms. If a child is looking like they're maybe getting ill, those children should be taken for testing and not sent to school if they're sick. And there may be value in again, considering whether or not if a child has had a case in their classroom, to avoid, for example, a high-risk setting like visiting a continuing care facility. But ultimately, the bulk of the recommendations we would provide would be identical to what we would ask every parent to do, which is to monitor very closely for any kind of symptoms, have the child stay home if they're sick, and get tested. And I don't know if Dr. Yiu, no, okay.
Operator, can you put through our final caller?
Brianna Carson-Smith, Global News.
Hi, thanks for taking my question. First of all, I would like to know where we stand with equipment. How are we doing in terms of the number of ventilators, ECMO machines, everything else that you would need in order to serve COVID-19 patients? How are we doing on equipment? And if we're nearing a shortage, how would we make up for that?
Yeah, so we've done a lot of work on equipment and supplies, anticipating a rise in the cases. And so when we look at ventilators, we have in excess of about 600 ventilators and about an additional 200, what I would call less than optimal ventilators, but nevertheless could be used. So I think we've got an ample supply of ventilators right now, and we also have sourcing with vendors, so we don't have a shortage for that. We've also looked at other aspects, such as other equipment. You mentioned ECMO, so again, ECMO right now for us is not an issue. And we've looked at supplies, including things like medications, and we know we're pretty good for the next 6 to 8 weeks.
Brianna, do you have a follow-up?
Yes, thank you. We know that vaccination is the way out of this. Speaking to people yesterday in rural Alberta, religion is playing a large part of why people aren't getting vaccinated, beliefs. And although we are seeing a small uptick, it still seems like there are parts of rural Alberta where people are very hesitant to get vaccinated. I know we've got the vaccine bus going around. How else what other plans is Alberta Health working on to get out to those communities and get these groups vaccinated?
So maybe I'll take a crack at it, and maybe if Dr. Dina Hinshaw has anything to add. We actually have started vaccinating with schools, and so we've actually have been going out to numerous schools across the province to offer vaccinations to the children 12 and over. And so right now, I think we've done over 24 schools, and obviously we've got a number to go, but slowly going up on those numbers, and that's all over the province. We're also doing, as you know, sort of the third boosters for seniors in congregate settings, and right now we anticipate that will be completed in that setting probably by mid-October. I would say that, the vaccination issue is a really polarized one, and I think we can't always make the assumption that it's because of the diehard anti-vaxxer beliefs. I think we really need to make sure that people are educated, that they're informed, and also to make sure that there's no barriers to accessing vaccination. So again, I really encourage Albertans that if you have any questions, please go to your healthcare providers, call 811 if there are issues that are preventing you from getting vaccinated. Let us help you, or go to the AHS website.
Okay, that concludes today's media availability. The next COVID-19 availability will be on Tuesday, September 21st. Thank you.